I already mentioned the CAR T cells, which are probably the most potent immunotherapy for also multiple myeloma. And there are different trials ongoing targeting a wide range of different target molecules on the myeloma cell. So CD19, CD44V6, CD38, BCMA, GPRC5D, SLAMF7, CD138, and CD22/9. So a huge range of different antibodies, and I probably missed a few that are also targeted in some studies worldwide. So again, but the main target currently used for CAR T cell therapy is BCMA, and probably the product which is most advanced in the clinic is the so-called ide-cel product, which is again a CAR T cell based on autologous T cells. It's introduced the BCMA directed chimeric antigen receptor is introduced in these autologous T cells by lentiviral gene transduction. It has a 4-1BB co-stimulatory domain, and it was applied in very advanced patients with multiple myeloma, mainly patients in 5th or 6th lines of therapy or even beyond. And these patients received the ide-cel product. And what we first of all saw is that when compared to other CAR T cells, like patients with malignant lymphoma receiving CD19 CAR T cells, the toxicity was clearly less. We had less cytokine release syndromes, less neurotoxicity. And in spite of the fact that these patients were really heavily pretreated, the product induced remissions in nearly all of the patients, with up to 50% complete remissions, especially in the patients receiving the highest dose of the CAR T cells. Now, there are also other BCMA directing CAR T cells in the clinic. So there is one from the Chinese company Legend, probably with the longest follow-up, and they actually have patients that are now more than 3 years in ongoing remission. Now with ide-cel, we have a progression-free survival in very advanced patients of about 12 months with the Legend product, and which is also now being co-developed with Janssen. This product in less heavily pretreated patients has progression-free survival that goes beyond 18 or 24 months. So clearly indicating that probably, again, if we want to cure a patient with these modern immunotherapies with multiple myeloma, we have to use them early. So a lot of additional CAR T cells are moving into the clinic now, and I think especially we've seen traumatic responses in these more advanced patients, but I think especially in earlier lines of therapy, I would be optimistic to really see patients with long-term disease control, maybe even cure. And now it's the time to optimally define the right immunotherapeutic strategy for the right patients at the right time of his treatment course. But definitely after already the monoclonal antibodies have dramatically improved the outcome of patients with multiple myeloma in the past, I see that these modern immunotherapeutic strategies, ADCs, but especially bispecific antibodies and CAR T cells, are really making a huge difference. And I think we'll see dramatic improvements in the survival of our myeloma patients with these novel treatment strategies.